As the world eases out of its cocoon after almost a month of being confined indoors, it is important to know the do's and don'ts of living with the coronavirus. But scientific data and doctors' advice can often be confusing for many. But illustrations like these help people understand which social situations to avoid and which to go ahead with in this new reality. Created by Toby Morris in collaboration with Dr. Wiles, a microbiologist, and published in an online magazine from New Zealand, The Spin-Off. The animated illustrations have simple explainers, like how to figure out your symptoms, or why must one wear masks and how to handle them.
So that people who wore them thinking they were protecting themselves would understand that actually that didn't make them invincible, and that they had to wear them properly, and that they were doing it as an act to help protect others. And it only really works well when everybody does that. So these are the kinds of things, the kinds of concepts I've been trying to explain in the graphics that Toby's beautiful, his beautiful illustrations are what bring those to life and what help people connect with them.
Or explaining in depth why it is important to continue maintaining physical distancing, and more importantly, the repercussions of breaking the distancing norm. Some of the scientific language is a bit different to common usage. Dr. Wiles and Morris laid that out simply.
I'm a scientist, but I've had a long-standing interest in communicating science. So we were thinking of things that would be shareable on social media, because actually, while I write big explainers about the pieces, what we really needed was things where people could really quickly understand the concept and how, what their actions needed to be. And so the kind of the short animated GIFs, they were the things that I guess seemed like the best fit.
There are other microbiologists helping the world understand the science and decode the data. Dr. Erin Bromage's blog post explaining how coronavirus spreads and what people can do to keep safe has been viewed more than 13 million times. An associate professor in a US university, Dr. Bromage simplified the data from various disease control centers across the world to explain where lies the risk and how to avoid them. Others, like renowned virologist Ian Lipkin, gave a simple list of do's and don'ts.
Most people want to go into work is that they want to have an opportunity to interact with their colleagues. To do this, you need to bear in mind the same rules we've had already for minimizing risk. The 2-meter distance between people in a conference room, for example, wearing masks. All of these things will be enormously helpful and will allow you to have conferences. And I'm eager to travel. If one were to go on a flight at this point, I think there are certain measures that you should take. We know that the virus entry is through a mucous membrane. That means the mouth, the nose, or the eyes. So if I were flying, number one, if I couldn't ensure that I had a certain amount of distance between me and other people, I would wear a mask, I would wear goggles, and I would wear gloves. That is the safest way to travel.
In India, government websites give out simplified instructions in vernacular languages and even sign language.